Hello guys, good morning. It's your doctor here, Veronica, and today we are going to talk about diarrhea. Diarrhea is an illness where the body's waste is excreted in liquid form, and it's caused by a virus called rotavirus, especially in children under 5. It could be caused by a bacteria called E. coli and a parasite called giardiasis. It is also prevalent among the poor living standards condition and poor hygiene and low public hygiene in especially in travelers diarrhea. We also have some chronic form of diarrhea like irritable bowel syndrome. Now let's begin with just the normal diarrhea. When you have loose motions of more than 3 times a day, it qualifies to be called diarrhea, and there's an abnormal stool forming whereby the patient has loose stool, and it could be also accompanied by vomiting, and it can lead to dehydration. Signs of dehydration is like tiredness. You feel like you are dizzy, and your body becomes weak. You lose appetite, and children mostly sunken eyes and a skin pinch of less than 2 to 3 seconds. So that qualifies to be called dehydration. So when you have severe dehydration, you'll have a skin pinch of more than 2 to 3 seconds when you pinch a baby's belly. Uh, a diagnosis is by physical exam, whereby you just look at the general condition of the patient. If the patient is on fair general condition, or the patient is looking dehydrated, this classification of dehydration. We have some dehydration, we have severe dehydration, yeah. And among the tests that you can do, you can do a complete blood count. You'll see the bacterial infection, maybe the lymphocytes could be raised. Yeah, it deranges the normal values of the test that you'll want to see in a CBC. CBC is a complete blood count, and it is the same as it's also known as full hemogram. You can also do a stool test uh, for microscopy over and cyst. From there you'll be able to make a diagnosis if there's maybe amoeba cyst. The cyst of amoeba, it's caused by an organism called entamoeba histolytica, and its treatment is by medications, and the medication specifically is antibiotics. You can use metronidazole. It has an antimicrobial effect, or secnidazole. Yeah, it especially acts on the anaerobic bacteria. And again, apart from antibiotics, you should remember that there are contraindications, especially people with liver conditions. You cannot give the metronidazole, and while using the metronidazole, you should avoid taking alcohol because it might lead to liver damage. And again, about dehydration, because it is diarrhea comes with dehydration, you'll have to replace fluids. If the patient is severely dehydrated, that is when you'll give IV fluids, the normal saline, to stabilize the patient, and also encourage oral fluid intake. Just the normal water, any food containing water and fruits, it also contains water, so you'll have to take a lot of them, even vegetables, so that you may recover. Again, let's now talk about the chronic diarrhea. In chronic diarrhea, we have severe forms like irritable bowel syndrome, inflammatory bowel disease, chronic disease, and ulcerative colitis. We have the malabsorption syndrome. We have endocrine disorders that causes diarrhea. We have food allergy and sensitivity to medicine. Like, some of the drugs have its side effects is diarrhea. It might lead to diarrhea. So malabsorption, let's begin with malabsorption. It comes with weight loss, bloating, and diarrhea itself. And its treatment is by use of antidiarrheals. Antidiarrheals are like loperamide. Loperamide you take 2 milligrams as a start dose, and then you'll take it uh, after every loose stool. So we have dietary modifications as the treatment of this malabsorption. One, you'll take the antidiarrheals, then you'll have to modify your diet by nutrient replacement and supplementation. For example, by taking fat-soluble vitamins and other micronutrients. Complications of malabsorption, we have the weight loss itself. It might lead to malnutrition, failure to thrive in children, delayed wound healing even in big people, and deficient immune system. We also have Crohn's disease. Crohn's disease comes with rectal bleeding, like its signs and symptoms is rectal bleeding, fever, weight loss, anorexia, nausea, vomiting, malnutrition, and generalized fatigability, and it might lead also to bone loss. And its diagnosis is by investigations such as colonoscopy and small bowel enteroscopy. Treatment is treatment of these Crohn's disease is by use of loperamide as the first treatment, and you can also combine with metronidazole and methylprednisolone. And again, I'd like us to talk about irritable bowel syndrome. Irritable bowel syndrome comes with altered bowel habits. Maybe you have increased bowel habits. You go for a long call severely, like you're having loose stool, maybe 4 times a day or above 4 times a day. It comes with abdominal pain, comes with abdominal bloating and constipation. Its signs and symptoms, it's you might have clear or white mucoid diarrhea. It comes with heartburns, vomiting, dyspepsia, and nausea. And again, you might have fever or might not have fever. You might also have steatorrhea, and painless diarrhea. Treatment is by having fiber supplement and water intake. Limit lactulose intake, probiotics, antispasmodics. Antispasmodics is like Buscopan, and antidiarrheals like loperamide. I'm ending the session, and that's all I had for today learning. So continue subscribing. There are more videos loading, and please support me. You might also consult me. You might feel free to leave your comment there, and please like my page, subscribe, continue subscribing. We'll learn more. We'll get to learn more and more.